The World Health Organization has warned that we're facing a tidal wave of cancer, thanks to lifestyle and eating habits. But is our public healthcare system prepared to deal with this crisis?
Ezekiel Malloy was diagnosed with cancer nearly 2 years ago. But like many patients who depend on South Africa's public healthcare system, he's had to wait months to be treated. And delays can prove deadly.
The worst part is the uncertainty. Not knowing whether today we'll get full treatment or we'll be sent back home. That's the worst.
Ezekiel's case has been taken up by Campaigning for Cancer, an organization preparing to take legal action against the health department for mismanagement and failing to provide cancer patients with the treatment they need.
What I've noticed about Ezekiel his health was deteriorating. Each and every day when I came to see him, it was not like when I last saw him last week. The following week was a different Ezekiel. And the other week was a different Ezekiel. It was like he was fading away from my eyes.
Cancer is the leading cause of death worldwide. Already more people die from it than TB, HIV and malaria combined. And in Africa, with limited healthcare resources, survival rates are often less than half those of developed countries.
Cancer is not a disease of the wealthy, it's the disease that everybody has to put up with. I mean, the commonest cancers in South Africa are diseases of the poor.
Today, Ezekiel has an appointment at the Chris Hani Baragwanath Academic Hospital in Soweto. But there are no guarantees he'll be seen by a doctor or a specialist.
Hey. No, kuyakwatisa kuspend imali kwehosi only for ukuthi uzojika lamateksi ayadura phela.
And amapain wona.
Ahlala khona amapain, ayikho enye into.
Cancer is a complex disease that requires a combination of surgery, radiotherapy and chemotherapy, and there aren't enough oncology units or qualified doctors to cope. So patients shuttle between hospitals, waiting for diagnosis and treatment. Ezekiel has been sent away again with no answers and no treatment.
Well, the recurring problems in the public health systems is delays. Delays in diagnosis, delays in referral, delays in getting treatment, just delays. And all these delays need to be attended to timeously, otherwise patients suffer.
Another appointment has been rescheduled for a month's time. He's in pain, and as he gets sicker, his anxiety worsens.
Surprised me to be taken back every time, more than 5 times. We send back, send back, send back. What are the doctors doing? And yet, I don't know what number in the queue, you see. Maybe I was 100 and something behind somebody. At some point, people are taken to the theater and then are brought back because they don't qualify for the operation. I was once taken back because there was no bed in the high care unit for me after the operation.
In South Africa, cancer is expected to increase by nearly 80% over the next 20 years. But already the system can't deal with the number of cases.
Unless we deal with these non-communicable diseases and diseases of lifestyle and change people's patterns of living, we're going to have a health crisis which is going to have enormous impact on the economy and on the society.
In Gauteng, there are only 2 state hospitals that offer full-line chemotherapy and radiation treatment, and there's a long waiting list and a backlog of referrals from other provinces and rural areas.
It's not nice because you're sitting until, because I'm having a spinal problem. So when I'm sitting for a long time, my spine hurts a lot, you know. So it's not nice to sit here all day.
At these units, equipment is faulty and radiation machines regularly break down. There are shortages of essential chemotherapy drugs and pain medication, usually because suppliers haven't been paid. So patient therapies get interrupted, reducing their chances of survival.
The numbers will get more, not less. So if you think we can't manage it now, it will only get worse as the years go by, because more and more people will get cancer.
By the time this woman's cancer was detected, it was too late. Doctors at her clinic failed to diagnose her breast cancer until it had spread to her lungs and liver. She passed away 2 years ago.
One of the problems is in Africa, and including South Africa, is that a lot of people present very late, and then trying to save lives becomes much more difficult and much more expensive. So we need to take a comprehensive approach which involves a number of different strategies, and unless we do that, and unless we balance our resources somehow between the preventive side and the curative side, I don't think that we're going to win.
South Africa doesn't have the human or financial resources to provide the correct level of care to all patients with cancer, so government focuses its efforts on controlling the disease by prevention and early detection.
You're going to hold up the knee?
The World Health Organization has a goal of trying to reduce the numbers of deaths from non-communicable diseases by 25% by the year 2025. And if we're going to do that, it has to be a combination of prevention, and I include in that primary prevention, in other words, that people don't get sick in the first place, and more secondary prevention or screening interventions so that we can pick up problems earlier.
Survival is low for childhood cancer in South Africa if it goes undetected. But when David Koch noticed his son Neo was listless and feverish, he acted immediately. He never expected it to be lymphoma, cancer of the lymphatic system.
So in my mind, I just told myself that cancer is like a death sentence. So I was scared that I'm going to lose Neo. But since the doctor came to explain to me that this cancer is different from that one that killed my father. This one for the kids is curable, as long as, especially when it's been diagnosed at an early stage.
David's quick action saved his son's life. When diagnosed early enough, 70% of childhood cancers are curable. David is a single parent who sacrificed everything to give Neo the best care possible, even his job.
Many parents, they left their jobs for their sons, for their children, many of them. That's why even myself, I nearly left my job, because many parents, they left because their employers were tough on them. He said they are not coming to work now. Why do we expect to be paid, and so forth? And it's like when you go to the space, it's like you are not working. It's like you have absconded. So me, I just decided no, to live under that pressure. It's better I must leave.
Cancer hits the most vulnerable hardest. We are only beginning to understand its terrible emotional and financial consequences, and acting fast is the only way out.